Good afternoon. This is your United States Congressman Van Taylor calling to invite you to participate in a very important telephone town hall today to discuss coronavirus and answer your questions about government response. Today, I'm joined by Collin County Judge Chris Hill, State Representative Jeff Leach, State Representative Matt Shaheen, and officials from the Collin County Department of Public Health. If you've never participated in a telephone town hall, here's how they work. We are currently dialing 70,000 households throughout Collin County, and many, many more are calling in. If you get disconnected from the call, you can call back in at 855-731-4614 or listen live at vantaylor.house.gov/live. Again, this is Van Taylor, your U.S. Congressman. You're on a live telephone town hall meeting. And for those of you that have joined and you want to ask a question, hit *3 on your telephone keypad anytime. We have operators who will take your comments, questions, and if you just want to leave a comment or a question for either me, Van Taylor, or any of the other people on the call, Collin County Judge Chris Hill, State Representative Jeff Leach, State Representative Matt Shaheen, the operator will take down your information and they will get it to whoever you want it to go to. So hit *3 if you want to ask a question. You will be temporarily removed when you press *3 to give the question to an operator, and then you'll be put back in the telephone town hall so you won't miss any of that. And again, this is Van Taylor, and the reason I keep repeating this for you at the beginning of the call is because more and more people are coming on the call every second. And with me is Collin County Judge Chris Hill, State Representative Jeff Leach, State Representative Matt Shaheen, and officials from the Collin County Department of Public Health. And if you would like to receive updates on the coronavirus, you can go to my website, vantaylor.house.gov/coronavirus, and you can click the sign up button and we will send you updates. We've been very aggressive about getting updates out to our constituents to give you updates on things that are going on regarding coronavirus. Our telephone lines are open right now, and if you have a question or you want to leave a comment, hit *3 on your phone, on your keypad right now. Go to an operator, leave your comment, question, put you back in the queue. And so again, thank you for joining. Again, this is Van Taylor, your U.S. Congressman here in Collin County. We're on a live telephone town hall event, and we'll be taking live questions. First, I'm going to ask our state representative, Jeff Leach, to just give us 3 minutes of your comments before we start taking questions from the audience. Jeff?
Well, thank you, Congressman Taylor, for hosting today's telephone town hall, and thanks to my House colleague, Representative Matt Shaheen, and County Judge Chris Hill and the Collin County health officials who've joined us to lead today's call as well. The good news, the best news right off the bat is I'm not going to take my entire 3 minutes. This call today is about the thousands of citizens, really not only in Collin County, but across the state of Texas who are joining us on this call today. This call over the next 45 minutes to an hour is all about you, the people. And so we're committed to keep our opening comments short and then opening up to hear your questions and receive your comments and concerns. Clearly, our state, our entire country, really the entire world, we are staring down the barrel of a crisis like we haven't seen in quite some time. Whether we're talking about the medical side of COVID-19, the coronavirus, the economic side, or just culturally how this is affecting our families, our churches, our communities. We haven't seen something like this in a long time. But I will tell you this, I wouldn't rather be anywhere else in the world right now than in the great state of Texas. We are uniquely positioned. We are well positioned to address this crisis, to tackle it head on. That's exactly what we're doing, and that's what we're going to talk about today. And so I want the people on this call, the citizens that we're elected to serve, our friends, our neighbors, our constituents, I want you to be assured that your leaders from Washington to Austin to our county commissioners court are committed to working together nonstop, 24/7 on your behalf, advocating for you, working with you, partnering with you to address this. It's a true partnership together with you, and I believe it's going to take that continued partnership over the next few days and weeks to defeat this virus, to keep our citizens safe and healthy, and to get our state and our country back on track. So in closing, my main message today, if you don't hear me say anything else over the next hour, is we're in this together, and sticking together, we're going to defeat this virus, and we're going to get this country and this state back on track. God bless you, and look forward to our chat today.
Hey, thank you, Representative Leach. Those were great words. Really appreciate that, and I think really well said. Now I'm going to call on State Representative Matt Shaheen, who represents southwestern Collin County. Representative Shaheen, would you like to? I'm going to give you 3 minutes to make some remarks.
Yes, thank you, Congressman, very much. And thank you for all of you that have really reached out to us, our individual offices, emails, phone calls, and of course, participating during this tele-town hall. Look, we know this is unprecedented times, but we wanted to assure you in gathering today that we're working hard to address the coronavirus. And it is important that we hear from you. I'm looking forward to listening to your questions and having that interaction. So, Congressman Taylor, thank you again for putting this together. It's important that we listen and hear from our constituents. I want to remind everybody that as, we're into the couple weeks of this experience and diving into all the details, that this is temporary and we're going to defeat the coronavirus. As a state, we've had to step up to many challenges, whether they're massive hurricanes. Remember, Ebola was in the state of Texas a couple of years ago. We've risen up to the challenge, and we're part of a nationwide effort to defeat this. So I'm sure many of you are aware of the restrictions that have been placed on the state of Texas by the governor as far as the number of people that can gather, limiting visits to nursing homes, closing schools temporarily, and of course our local political subdivisions can add on top of that, and many have. And so we're working hard on your behalf. We're literally having daily calls, including calls with the governor, let alone the education commissioner, of course our local officials, the comptroller. The response is immense, and we're going to tackle this. And so all levels of government are working well together. We're well coordinated. And we're going to ask you all to do your part as well as far as social distancing and limiting your gatherings and those types of things. So thank you all. We're looking forward to your questions. And I think our county judge, Chris Hill, is next.
Yeah, Judge Hill, since you've just issued today an important order for Collin County, I thought we'd give you 5 or 6 minutes to make your remarks. But in particular, I'm sure I know we've already gotten some questions from people that are asking about your order, so you may want to talk about that in your remarks. So, Judge Hill.
Thank you, Congressman Taylor, for hosting this town hall. I appreciate you bringing us together again on this important topic. I'd like to echo what my colleagues have shared, that this is perhaps the most critical event that we've had to navigate in recent history, and it is. I am so pleased to see the teamwork and the collaboration at all levels as we work to face this head on. To all the constituents that are on the call today, thank you for taking time to join us in this important conversation. As Congressman Taylor referenced, today I issued my executive orders on workplace rules and guidelines for Collin County. And I'm going to go through those for a moment as we start this conversation and just explain that first and foremost, we want to make it absolutely clear that across all levels of government, our primary objective is to protect the physical health and well-being of our Collin County citizens. That is absolutely our number one goal, and everything we're doing is to achieve that goal. Now, there's a series of guidelines and a series of orders that came out today. The first of those is that those persons in Collin County who are sick, who are symptomatic, have an absolute responsibility to take actions necessary to protect the health of others. If you are sick, if you're currently experiencing symptoms, you are ordered to stay home until you are fever-free for at least 72 hours without the use of medicine that reduces fevers, and until your other symptoms have improved, and until at least 14 days have passed since the symptoms first appeared. Now, let's be real for a moment, folks. That's what Grandma told us. Those are the guidelines that we all know, but we put them on paper anyway because they're critically important. If you are ill, you stay home. You don't go to work. You don't go to the store. If you need something from the store and if you need food, you call a friend and have them bring it to your front porch. That is absolutely critical for the health of our community. First and foremost, if you are ill, you stay home. Now, we also have a number of folks in Collin County that feel that they are exceptionally vulnerable right now. And in fact, we do have a good number of folks who are at greater risk for severe illness. And so the second provision in today's guidelines clarifies that if you believe that you are at higher risk for severe illness, if you believe that you have a higher potential for compromise from exposure to COVID-19, you have a duty to stay home. We need you to stay home. We need you to stay home to help, because all of these efforts that we're undertaking as a community together are to make sure and protect the public health of all of our community, especially those that are the most vulnerable. So we need you to stay home. Now, this order does provide that if you don't believe that you are at higher risk, or if you believe that at some point you're no longer at higher risk, then you're free to go back to the orders that exist for everyone in our community. Now, what does that mean? Well, the CDC provides guidelines to us that those typically at higher risk are any persons aged 65 and older, persons who live in a nursing home, persons with other high-risk health conditions like chronic lung disease or heart disease with complications, or folks that are immunocompromised, including those that are undertaking cancer treatments. But this order does not say that if you are over 65, you must stay at home and you cannot leave. That's not what it says. It says if you believe that you are at a higher risk, then we are counting on you to stay home and stay healthy. So I want to make that real clear. Some folks that are over 65 but are in great health and don't feel like they're at higher risk wanted some clarification today. So let's provide that right off the bat. The next point, and this is perhaps what's given some folks some consternation, and this is the very key that we get this right off the bat. In addition to protecting the physical health of our community and of our people, we also have to take steps to protect the financial health and well-being of Collin County citizens. Now, you need to understand what that means. We're not talking about we want to make sure that you've got a healthy 401k account. We're not talking about looking at your stock portfolio. We're talking about at the local basic family level. We know that as we are taking extraordinary steps for the next 2 to 4 to 8 to 12 weeks to pull through this as a community, you're going to have needs, financial needs, including your basic needs of food, shelter, clothing, and health care. And if you're able to work according to these best practices and guidelines, well, we need you to stay employed. So let me explain real quick what we're saying here. Every business and every job and every worker is essential to somebody. Every business and every job is inherently essential to somebody, because somebody counts on that job for their own income to provide their basic needs for their family. But that does not mean that every business and every job is going to be able to stay open. But folks right now are looking for guidance on, am I on the essential list, which means I get to stay open, or am I on the non-essential list, which means I don't get to stay open? We've taken a different approach here in Collin County because we recognize that every job is essential to somebody. And if you can perform your job, or if you can conduct your business in a way that protects the public health and prevents the spread of COVID-19, then we would like you to stay open. If you can't stay open.
Hey, Judge.
Yes, sir.
I'm sorry to interrupt you, but we actually have a question from McKinney. So this is our
jump to that.
First question. We got Larry from McKinney, and Larry actually has a question for you, Judge. So this is right up to you. Asking about the county order. So if we could, if you don't mind, if we could just get Larry in here. Larry from McKinney, what's your question for Judge Hill? Larry, are you on the line? Larry, I'm trying to. Unfortunately, I think we lost Larry. Okay, Judge, I'll give you 30 seconds to finish up your comments, and then we'll go to the next question.
Thank you, Congressman. Let me just clarify with this, and I'll end with this. If you can run your business and you can keep your employment and still follow all of the guidelines for public health, we want you to do that. We need you to do that. If you can't, if it's not possible because inherently in your job or in your business you have public gatherings over 10, you have people that can't do social distancing the way that we need you to, then we're going to count on you to close that down, or we're going to tell you that you have to close that down. That's the guideline, and we probably have a chance to get into that more here in a bit.
Yeah, I think we are, Judge. I just want to say thanks to everybody for being on the call. Really appreciate it. Again, this is Congressman Van Taylor. I'm your U.S. Congressman. You've got State Representative Matt Shaheen, Jeff Leach, and our county judge, who's the CEO or the mayor of the county judge. We really appreciate having him. So Jason from McKinney has a question for Judge Hill. So Jason, are you there? Jason from McKinney. Oh, hello, Jason.
Hello.
There you are.
Yes.
Yeah, Jason, I can hear you great. What's your question?
So my question is, I'm really curious, even given protecting the necessary jobs, why we think we're a little more invincible than every other county in the state that has kind of limited the stay-at-home or limited people from going to and from truly essential businesses when you're contagious before you even show symptoms. So we're allowing people to just get out there and pass this along. And I'm afraid that Collin County is going to become the epicenter in Texas because we're ignoring what everybody else is doing because we're trying to protect some citizens when I think, we can all step up to help them in other ways without keeping them going to and from work and getting everybody sick.
Okay, Jason, thank you. Really appreciate that question. And Judge Hill, you can answer that, or maybe you want to refer to one of the Collin County health people that you've got on the. I know you did. We have some special guests here today. We have several. We have an epidemiologist, the Collin County Health Authority, people like that are on the call that can answer questions if Judge Hill wants to call on them. So Judge Hill, I'll let you take it from here.
Thank you, Congressman. And Jason, thank you for that question. We can hear your concern and your passion in your question, and I really appreciate that and respect that. Let me assure everybody that's listening, folks in Collin County are no more immune to the aspects of COVID-19 from the challenges of COVID-19 than any other community. We are absolutely in this together with all of our neighbors here in North Texas. Now, here's the way I would explain this to somebody who's listening on the decision about businesses. There's another example out there where a county said, okay, these businesses on this list are essential and they can stay open, but these businesses on this other list are non-essential and they can't stay open. But I would say that even in that scenario, those businesses on the essential list still must use common sense and follow the practices and the guidelines that are provided for the prevention of COVID-19 in order to decide whether they can stay open. In fact, it might even be more dangerous if a business looks at the list and says, oh, I'm on the list, I can stay open, especially if that particular business is not able to practice social distancing in their business format. So we've taken a little different approach to get the same message out. And let me be clear here. I would say that Judge Clay Jenkins in Dallas County and Judge Andy Eads in Denton County and Judge Glenn Whitley in Tarrant County all have the exact same goal that I do, and that is keeping our people healthy. So our approach has been this. We know that every job is essential to somebody. If you can follow the guidelines and still work, then you can stay open. If you can't follow those guidelines, you can't stay open, regardless of what list you're on. If you can't follow the guidelines, you need to close.
Thanks, Judge. Really appreciate that. Our next question is a question Catherine from Plano is asking about unemployment, about applying for unemployment. Catherine, would you like to share a question with everybody?
Sure. I live in Plano, but I work as a dental hygienist in Dallas, which, as you know, we are closed down. And I will be getting one more paycheck, and after that, I'm on God's good grace. So my boss told me I could not apply for unemployment unless he officially temporarily laid me off, which he has not done. And other friends in the dental world of mine said, go and apply now. And I've tried, and I can't get past page 1, I guess, because of the overflux of people applying. Is there any updates, or what is the latest on applying for unemployment? Am I able to do it without my boss laying me off, or is that something that is step one to me trying to claim unemployment? And I'm not afraid to go get a job either, but trying to match my current income is going to be a challenge.
Completely understand that, Catherine. In Congress, we're working on making it easier to access unemployment. We're trying to increase. There's legislation in Congress today. It hasn't passed yet, hasn't been signed, so don't bank on it. But trying to increase unemployment benefits. But I thought maybe Representative Shaheen, since unemployment is administered by the state of Texas, and I know that Governor Abbott was talking about this on Friday on a conference call we were on. Maybe Representative Shaheen, would you like to take this question?
Yeah, absolutely. What I would encourage you to do is visit the Texas Workforce Commission website. Some of the actions that the governor has taken is he's actually waived some of the requirements as far as being able to collect unemployment. And there's been some other actions as well. So what I would encourage you to do is do two things. One is visit the Texas Workforce Commission website. And then if you need any help at all you need to do is reach out to my office. You can send me an email. You can go to my House member's website. My district office information, capital office information is in there. But let me go ahead and just give you my email address. So if you run into some kind of brick wall, you can email me, and we'll get you the answers that you need and get you the help that you need. So it's matt.shaheen, and that's SHAHEEN at house.texas.gov. So I just want to encourage everybody that's on the call, go to the Texas Workforce Commission, and your answer should be, your question should be answered there. I would ask you to be a little patient. As you can imagine, the website's getting inundated, but you will be able to eventually get through and get the answers there, and they'll walk you through the application process as well.
Hey, thank you, Representative Shaheen. Really appreciate that. Catherine, thank you for asking a question. I know I just could tell you in our office, we're getting a lot of questions about that, and you guys, Representative Shaheen, Representative Leach, have been really terrific about helping people with that. So grateful to you guys for helping people with that. Our next question comes from Frisco, Texas. Corrine, you have a question regarding PPE. Maybe you can explain to everybody what that is and what your question is.
Hello?
Yes.
Hi. So my husband is a nurse, and there's an obvious shortage of PPE for the healthcare workers. We've made our climate very friendly for companies to come here. Is there any company that we can partner with locally at the state level so we can get some production in place? So we can get our healthcare workers protected.
What PPE is? Tell everybody what PPE is.
It's personal protective equipment for healthcare workers that are interacting with infected people. And there's a huge lack of that right now, nationwide and locally.
Yes. Well, thank you. First, tell your husband thank you. We appreciate him being on the front lines of what is clearly the greatest challenge of our generation. I mean, this is a heck of a challenge, I think, for all of us. And I want to say that, I literally in the last 24 hours have spoken to two different businesses. One was making painting supplies, and they have shifted to making only hand sanitizer. They're in the process. They're actually located right here in Collin County. Talked to another business last night who said, you know what, we usually make signs, outdoor signs. We're going to start making protective masks, and they're actually delivering some tomorrow to a fire department, delivering protective masks. So I'm watching businesses across this great country, come together, retool what they do, and get in the fight. And it's a great thing to see. And I don't know, Judge, do you want to add anything on PPE, what you're seeing at the county level?
Congressman, thank you. No, I think that's a great answer. I don't have anything to add here at this point.
Congressman, this is Matt Shaheen. I actually have an update from the state. if that's okay.
Sure. Yeah.
So we've been aware of the short. It's a great question because it's a concern really across the state as far as that protection is obviously very important. This is something that the state has been working on. We've actually the governor's formed a task force to address all the procurement needs for this and other items like respirators and those types of things. We're at a point now where the state of Texas is actually receiving over 100,000 new masks a day. And our expectation is that number is going to continue to grow, that by next week we'll start receiving about 1 million per week. So we're in the process of ramping up, and we will get those distributed across the state of Texas. So that is in process.
That's a great answer, and thank you for that. I think the answer is, people are mobilizing, businesses are mobilizing, citizens are mobilizing, and it's a great thing. It's very inspiring to me to see how our community is coming together to take this challenge on. Our next question is from Victor in Plano, who wants to talk about the Texas Virtual School Network. Victor from Plano, Victor?
Yes, sir. Hello.
What is your question?
My question is about the Texas Virtual School Network. It's a public school alternative that's been around for quite some time, I think maybe a decade or so, but I haven't really heard it being used much in the context of a replacement or a supplement for the schools that have had to close or send their students home. Do you have any information on how they're planning on implementing that a little more, stringently?
Sure. No, appreciate that question. It's a great question. I think, I just want to say, everybody on this call has been on the phone with each other pretty much every other day for the last month. So we're all working very closely together, county government, federal government, state government, city government, school districts. And so I know that all of us have been on the phone with our various school boards, working through a whole bunch of issues. But I know State Representative Jeff Leach has been a real leader for education in Collin County for some time. Jeff, do you want to talk about the Texas Virtual School Network and what we're doing about school in Collin County?
Yeah, Congressman Taylor, thank you, and thank you, Victor, for the question. Without question, without reservation, this crisis has hit our schools and our educators and our students and their families relatively hard. As you know, the vast majority of school districts, over 90% of Texas school districts, actually all of them right now, are closed temporarily. Over 5.5 million public school children, including my own 3 children who are here with me listening on today, or at home today, not in school, are all across the state, not in their classes. But that said, while that has presented us all across the state certain challenges, it's also brought out the best in our educators, our parents, our communities, and in our students. The virtual school network, Victor, is being utilized. We're trying to figure out ways in collaboration with our school district leaders, our parents, with the TEA and the governor's office across the state to utilize the virtual school network in a broader, more robust way. I know that while our teachers are not with our kids in the classrooms on a daily basis like they normally are, they are working very diligently, as our educators always do, in still providing instruction. Just today, my 2 children, Brady and Charlotte, a 3rd grader and a 6th grader, had Zoom classrooms with their teachers, sitting in our living room with their teachers in their living room, still learning, still receiving instruction. And so while our school campuses are closed, I hope the listeners on this call will be assured, the taxpayers on this call will be certain that instruction is still going on throughout this state. We're being creative. We're using the resources that we have, including the virtual school network, to ensure that the students of today are not hurt in any way, shape, or form.
Representative Leach, that was a great answer. Really appreciate that. And I know we've definitely seen these are challenging times for our schools, but I think they're definitely rising to the occasion. For our next question, we have Cassandra, who wants to ask about how we determine the bans. Cassandra, are you on the line?
I am.
Cassandra,
Hello.
could you? Cassandra, great to have you on the call. Where are you from?
I am in Dallas, but I do
Great.
live
Okay.
in Collin County.
Yes, you do. Outstanding. All right. Well, and what's your question?
My question is, how is the time calculated to when the bans are going to be lifted? Is that, and how often is that
Sure.
calculated? And then,
Great question.
then my other
You got a follow-up question. Okay.
my other thing is more of a statement rather than a question, and I just wanted to say how grateful I am, because I voted for most of you, and I am so grateful that we have got such incredible leadership in Texas, that you actually care about the taxpayers and the residents here, and that's not always the case. And I just wanted to say thank you and how much you are appreciated.
Wow, Cassandra, thank you. That is very, very kind words. We'll work hard to live up to that. That is really, really kind of you. And that's a great question. Judge Hill, would you mind just introducing? I know we've got a doctor and Ms. Powers, an epidemiologist, on the line. If you could introduce them, and maybe they can talk a little bit about some of the when hopefully this will be soon. When under what circumstances will we lift the ban?
Yes,
Judge Hill, you want to kick that off, and I'll let you lead it with your people.
Absolutely, thank you. So I'm gonna introduce now Grace Powers, one of our epidemiologists in the Collin County Public Health Department, to talk a little bit about what we may see on the horizon.
Sure. So when we are thinking about things moving forward, we always want to look at the epidemiology of the disease. How long are people sick? How long are they contagious? What's the incubation period? And we kind of try and make predictions when it comes to bans and things like that. And we always consult with our judge on things like that.
And Van, let me throw in just a real practical sense. So the order that was made today, my order, is good for 7 days, which is consistent with state law, unless the Commissioner's Court agrees to continue it. The order that I made previously, the Commissioner's Court did agree to continue that, and that order will remain in force until the Commissioner's Court changes its mind or until the statewide disaster declaration is lifted. And I think you're going to see that all of us at the local level are going to start coordinating, and have already been coordinating with the governor's office to make sure that we're on the same timetable. And of course, the governor's office is looking to the national leaders as well, as we all work together.
Great, really appreciate that. And obviously, it's so reassuring, Judge Hill, to know that we've got great epidemiologists like Grace Powers there working for us here in Collin County. For those of you that have questions or comments, hit *3 on your phone, and that way we can get you in the queue. And if we can't get your question, just know that there'll be a chance to leave a voicemail at the end of this conversation, so that you can leave anything you want. If you want one of us to call you, just let that be known, and we'll make sure all the messages are distributed to whoever you want to direct it to. And if you want it directed to all of us, we'll make sure the message gets to everybody, all the elected officials on this phone. So John in Plano, I think you have a question for Judge Hill. So John, what is your question?
So my question is what is being done to get the hospitals the equipment they need to handle the onslaught of people that's going to come once people start getting tested?
Yeah, John, great question, and that's certainly something that I hear a lot. And so I think we've got the resident expert here in Collin County, Judge Chris Hill. Chris, would you like to answer John's question?
Yeah, thank you, John. That's a critical question for us as we are looking towards the coming weeks. I'm going to pass this question actually to one of the members of our team. This is Taylor Burton. She's our Public Health Emergency Preparedness Coordinator, and this is right up her alley.
Perfect. Great. Thank you. So to get the hospitals the supplies they need, we know many are looking at shortages. There's a couple of mechanisms in place. So the first one is that we're referring all the hospitals to the current guidelines on how to make their existing supplies last as long as possible.
So the federal government has put out, and the state government as well, lots of great resources for them to show what situations do you need certain levels of equipment for, when can you use lesser ones, when can things be reused versus when they can't, to make things stretch a little bit longer than they normally would. The other mechanism that's in place is that hospitals can let the government know when they're running critically low on these assets, and requests can be placed to the state of Texas. So the way they do that is they contact their city's emergency management agency and tell them that they are critically low. However, please keep in mind that the entire state is critically low, and we absolutely hope we get those respirators and other things that the representative told us about earlier. But they're filling those as quickly as they can, and they're filling those with the most critical needs first.
Thank you. Appreciate that. And I hope people understand that, we've got a team of people who are competent, prepared, ready to act, and are acting right now, at the county level, at the federal level, at the state level, who are addressing some of these issues. So just so you know, we're working together. This is a whole of government approach. And more importantly, it's a whole of society approach. I'm watching every American is taking a role in beating COVID-19 and trying to minimize the impact it's going to have on our society. Now, before I take the next question, I just wanted to give every single person on this call a chance to sign up for future telephone town hall events. If you want to participate in a future event, just press 1 on your phone. That's all you have to do. It'll stay right in line. But if you want to be on the next, if you want to, and you don't have to, you're not committing to be on it, but you just want to know about the next one. You want to make sure that we let you know about it. Just hit 1, and that way we know to reach out to you and make sure, because we can only make 70,000 phone calls in one of these. My district is 750,000 Texans, so I can't call every single person every single time. But if you want to be on the next one, just hit 1, and we'll get it. We'll put you on the call. So the next question is a question actually for me. This is for, Rita from Allen. What is your question about, Rita? Rita, oh no, she dropped off. Well, I'll just. Her question, as I understand it, is that she was asking what has Congress done for workers, and what we have done so far for workers is we have funded corona testing to make it free. We did that on March 3rd at the beginning of this month. And then we also set up emergency paid sick leave and qualified paid family leave. We actually funded that. We increased funding to the states for their healthcare needs, and so those are some things that Congress has done. We're working on additional legislation, which I think will be further help to workers. But there is no question that this has put a lot of strain. There is a healthcare crisis, and then there's an economic strain that has been put on our country as a direct result of this and dealing with it. But I thought Representative Leach, Jeff, I don't know if you wanted to chime in on what we're doing to help workers at the state level, if you wanted to comment on what we're doing. Jeff, did you want to make a comment on that?
Sure, Van, and thank you for what you're doing to fight for the taxpayers and citizens of Collin County in Washington. I think I could speak for all of the folks on this call, and we watch the news, we hear reports, and we see what's going on in the halls of the Capitol in Washington, and many times it can be frustrating and concerning. But for those of you on this call, I know firsthand, and you can rest assured that our Congressman Van Taylor is fighting for taxpayers and for workers and for you. As for the state of Texas, I want to be really honest with you and tell you the best thing that we can do, the best thing that all of us on this call can do, no matter where you live, what job you have, where your kids go to school, for workers in this country, for our economy, is to get this crisis behind us as soon as possible. And the way that we're going to do that, as you've heard on the news, as you've heard on this call, as all of us know, the way that we can do that is to follow the guidelines from our health experts. Every day I'm on the phone with hospital CEOs, medical professional staff from our district, on the phone with policymakers and with constituents, and everybody agrees universally that if we can just kind of lock down here temporarily for the next couple weeks, as the president has said, for the next 15 days, to stay home if you can, to only go out when you absolutely have to. Yes, to support our small businesses, to do everything you can to keep yourselves and your families safe. If we can do that over the next 15 days, I believe, as the president said today, by Easter, we could perhaps be over the hump on the hill and be on the sunrise side of the mountain. And so I just want to encourage you, if you're listening on this call, to do everything you can to keep yourself healthy, to stay home if you can. Once we do that, we're going to get this economy rolling again for the workers and taxpayers of the state of Texas.
Well said, Jeff. Really appreciate that. Our next question, and I think this is going to go to Judge Hill, is Herschel from Plano has a question about daycare facilities. Herschel, are you on the line?
Yes, sir.
All right, Herschel, fire away. What's your question?
Based on the order that we received and what you were saying earlier about businesses and the nature of the businesses that need to observe the social distancing, my question is, how will this impact daycares that are still currently open, and will they stay open?
Judge Hill, do you want to take that?
Herschel, that's a great question, and you've hit on one that actually is a challenge for all of us here in North Texas and across the country as we deal with the critical needs of responding as well as the essential needs of our daily lives. We all recognize that daycare centers are absolutely violating that common sense principle of social distancing, and yet so far all of our North Texas counties that I'm aware of consider daycare centers an essential service. And so it's one of those risks that we accept. We try to implement all the best practices of social distancing and of great hygiene, but we understand that if we're going to keep our first responders and our medical professionals, if we're going to keep them working, in addition to other folks that are providing essential services, we've got to answer that question about children and child care. And so far, everyone has child care centers on the essential services list.
Thank you, Judge Hill. Really appreciate that. And thank you, Herschel, for asking that great question. Appreciate that. Thanks for explaining that. Unfortunately, everybody, this is going to be the last question. But if you stay on the line till the end, there'll be an opportunity to leave a voicemail, and you can leave any comment you want. If you want someone to call you back, be sure to give your phone number clearly or give your email address. Who wants to email you back, and we will definitely make that happen. So this final question is actually once again for Judge Hill. Judge, Josh from Plano has a question, and I was thinking, Judge, maybe not you, but one of your healthcare professionals there can answer this. Josh, are you on the line?
Yes, sir.
All right, Josh, what's your question?
Yeah, so just real quick, first I want to say thank you to Judge Hill. I know it's been difficult to make a lot of these decisions lately, so I appreciate the limited government order that you put out there, trusting the judgment of Collin County citizens. So just want to give some positive feedback for that real quick. My question, and if I can squeak in two, I think they both would probably be for the health officials. My first thing is trying to figure out if we have any projections on how truly bad this would get in Collin County. In the press, we see a lot of doomsday projections. They're talking about Italy. They're talking about mass hospitalizations. I'm trying to get a fix on how much of that is fact versus fiction. And the second half of that would be, we've also heard some talk about these two drugs that are possibly either treatments or cures for COVID-19. And this might be for you, Congressman, because I know there's a regulatory angle to that, but I'm just wondering what all is involved in actually fully doing a trial of those things and determining if they actually could get us ahead of this.
Thank you,
Judge.
Josh.
You want to let one of your healthcare pros handle that?
Absolutely. It's a great question, and we're going to ask our public health authority, Dr. Sadia Siddiqui, to answer that question for us.
George, thanks for your question. So answering first, I'm going to answer the second part first about the clinical trials, what clinical trials are going on. So there are, you must have heard about Seroquel as well as Zithromax, which is a Z-Pack. It is it's not FDA approved yet, I will ensure that, but it is going through investigational studies It's approved for only compassionate care, which means that it is only for clinical trials and investigational use for critically ill patients. It's not for general public at this time, as FDA is putting different clinical trials for that. There is another antiviral Remdesivir, which is an antiviral which is also approved for compassionate. It's also only for critically ill patients since it's IV. It's also going through clinical trials. People are signing up for that. I can do that. And your first question was projecting. We don't have any data, but we do believe our healthcare system is strong enough to combat this, calamity, and we are going to. So we don't have it projected at this time. As we talk about flatten the curve, the basic thing is to self-isolate, and I cannot emphasize enough to self-isolate if you are sick and do not expose other people.
Doctor, thank you. Really appreciate that. I'm just going to just say that, here, the CDC has estimated that if America does nothing, 1.7 million Americans will die from COVID-19. That is a really staggering number when you consider the Spanish flu killed 675,000 Americans 100 years ago. Not trying to scare you, but I just want us to have a sober idea about the incredible challenge that is facing us. This is a challenge that none of us have ever been through before. But what I see every single day as I talk to people around this great county, as people are coming together, I'm seeing businesses retooling to make hand sanitizer. I'm talking to people who are trying to figure out how they can keep their business alive and yet social distance. I'm talking to people who are mobilizing to fight this great challenge of our time. And what's incredible about it is every single person in our country has a role to play. Social distancing, slowing the rate of growth, lowering the curve, those things are going to save lives. And so everybody on this call has a role. I am grateful for the opportunity to serve. I want you to know that we're elected officials at every level of government are working together. We're coming together like I've really honestly never seen before. And we're taking on incredible challenges, and you're watching a tremendous amount of action to take on this challenge. So with that, I'd like to give 2 minutes to Judge Hill. Judge Chris Hill, if you could take a second and give us 2 minutes of your final comments for this call.
Congressman Taylor, thank you for bringing us together today, and thank you to all who took time out of your afternoon to join us. This is, as we said at the beginning, just a critical conversation for us to be having together as we work together as a community. I believe Representative Leach said this earlier in the call. This is going to take all of us implementing the best measures that we can muster to keep each other safe and to beat coronavirus here in Collin County. I know we can do it if we pull together. We've got the resources here, but we now count on all of us being a part of that solution. Thank you, Congressman.
I appreciate that, Judge Hill. Chris, really great comments. Representative Shaheen, Matt Shaheen, from the great city, House District 66. Matt, I give you 60 seconds to make some final comments.
Well, Congressman, thanks again. I think this is just so important that we hear from our constituents. And I want to reassure everybody, we're going to continue to work on this. We're continuing to monitor this. We're literally some days we're on hourly calls. And a lot of information is changing out there. I want to encourage people that Texas has a great website, the Texas Health and Human Services website. If you just Google that, you can find some great information on that website. And then I just want to, real quick, talk to the moms and dads out there. I know this is especially hard for you. Your kids are at home, and we guess that your children are probably scared and nervous about this. And I just want to let you know that you can reassure your children that they're safe. They're totally safe. We're going to do everything we can to keep them safe, and this is temporary. We're going to get through this. So we're available to each and every one of you. Please continue to reach out to us. We'll get back to you and answer your questions as soon as possible, and we are going to defeat this. So thank you all.
A great optimistic note, Matt. Really appreciate that, and thank you for being on this call. Representative Jeff Leach, House District 67. Jeff, if you've got 1 minute of comments.
Well, thanks again, Van, for hosting this call, and Representative Shaheen and Judge Hill for joining us. And as I said earlier, to all of you, all the citizens, the constituents, taxpayers, neighbors, and friends who have joined us today, I want to thank you. The message that the four of us want to give you today more than anything is, number one, we're in this together. This is a partnership, a collaboration, and two, we're going to beat this together. This is a complex crisis, and it's going to take all of us, not just elected officials in Austin or Washington or here in Collin County, but citizens together, us and you joining together, arm in arm, to defeat this together. As for me and my staff, for District 67, the constituents that I'm elected to serve, we are communicating and collaborating actively on a daily basis with local medical experts, CEOs from local hospitals, medical staff, small business owners, moms, dads, educators, and I'm hopeful. I am very, very hopeful. When I look at the sun shining down on Collin County today, something that we haven't seen in several days, I think that's a sign to us from the Lord that we can trust Him, and that if we stick together and rely on each other and attack this aggressively, that we can beat this. And I believe that sooner or later, we're going to look at COVID-19, the coronavirus, as a thing of the past and have a bright, bright future in the short term for the state of Texas and this great country. So let's be in it together. Let's commit together to beating this. And thanks for joining us today on this call.
Yeah, again, this is Van Taylor. I just want to say thank you, everybody that took the time to be on this call. Judge Hill, Representative Shaheen, Representative Leach, thank you for your leadership and your efforts. I just want everybody on this call to know that we are working tirelessly. We're getting up early, going to bed late, making calls, talking to people, conference calls, at all levels of government. We're all working on this together, and everybody here has a role to play. Reducing human interaction, social distancing, that is going to slow the rate of infection, and that is going to save lives. This is a tremendous challenge for our generation. Perhaps I pray this will be the greatest challenge of our generation. That nothing will be harder than this. But this has clearly turned things in a direction we never saw. But I have every confidence that we're going to beat this, that we're going to put this behind us, and that we're going to make the right decisions to mitigate what could be mitigate this. So I'm grateful for the opportunity to serve you. Appreciate everybody being on the call. And at this point, I'm going to actually hang up, but you will have a chance to leave a voicemail. So if you want to stay on, leave a voicemail. One other thing I'll say: if you go to vantaylor.house.gov, where you just leave a message, a voicemail, we will put you on our email list. We are updating people with what's going on, especially at the federal level. At the level of the federal government, a lot of things are happening very quickly. So if you want to get updates on what's going on at the federal level, just leave your voicemail. In your voicemail or your email address will sign you up, or you can go to vantaylor.house.gov. You can sign up there. So again, thank you for being here. I know we're going to be successful, but I'm also confident that the hardest days are yet ahead. So thank you, and God bless.